day everyone, my name is Mary Rosie Garcia, a secondary nursing student from Section Waddingbank. So for today's video, I'm going to perform an administration of medication by inhalation or nebulization therapy. A nebulizer is attached to a flow of oxygen or air, converts a solution of drug into aerosol for therapeutic inhalation. For the assessment, first you have to evaluate the patient's need for nebulization. Next is you have to review or evaluate the patient's ABGs, the sputum culture, and the chest x-rays. We have also to review the physician's nebulization order for the length of treatment and the medication to be used. Fourth is you have to assess the patient's lung sounds before and after each treatment. Assess or observe the color, the consistency, and the amount of expectorated sputum. Also to assess the need for additional physiotherapy to improve respiratory function and to assess the patient's respiratory and pulse rate to establish a data baseline. The objectives is to deliver aerosol medication to promote better ventilation, prevent or treat atelectasis, to administer mucolytic medication to lower the viscosity of secretions and also to aid the expectoration, to decrease pulmonary edema, to deliver an antibiotic for the patient who have a chronic purulent infection, and also to decrease the work of breathing, to administer bronchodilators for the relief of bronchospasms associated with respiratory disease. The medication as well as the administration by air or oxygen is prescribed by the medical practitioner. It may be diluted with 2 to 3 ml of normal saline and is normally prescribed 3 to 4 times a day. The procedure may be coordinated with chest physiotherapy and is administered by the nurse or the physiotherapist. For a patient with asthma, an estimation of peak flow of tidal volume may be recorded before and after nebulization therapy. For the equipment, we need prescribed air supply, pipe in cylinders, or via a portable air compressor, adapter, nebulizer apparatus or machine, mouthpiece or appropriate oxygen mask, prescribed medication, and the sputum cup. Check medication administration order against physician's order. Comparison helps to identify errors that may have occurred when orders were transcribed. Always remember that the physician's order is a legal record of medication orders for each agency. Know the purpose, actions, adverse effects, and special considerations of medication to be given to the client. This helps to evaluate therapeutic effects and it helps you to educate your client about the medication. Prepare medications on a tray. Organizing things properly facilitates error-free administration of medication and saves time. Transport medication to the patient's bedside and keep the medication inside at all times. This prevents accidental or deliberate disarrangement of medication. Identify the patient. Check the ID band or ask the patient of his or her name. This step ensures that the right patient receives the right medication as ordered. Explain the procedure to the patient. This helps to gain cooperation from the patient's part and to lessen anxiety, thereby promoting effectivity of therapy. Fill securely the nebulizer cup with prescribed amount of medication. This ensures that the required medication is exactly given. Turn on the power button of air compressor. This ensures that the efficient vaporization of medication is to be given. Observe the fine spray from the nebulizer. This is a good way to check if the equipment is really working. Encourage the patient to breathe deeply the nebulized vapor via mouthpiece or mask. Breathing deeply can maximize the effect of medications as it travels directly to the lungs. Remain with the patient until all the solution has been nebulized. Remember that lack of mist means that the client has not inhaled the entire dose. Encourage the patient to expectorate. By applying half-cuff technique could be helpful. Just sit upright, breathe 3 times, bend arms, raise elbows and hold breath, then exhale forcefully. This will be helpful for the medication to loosen bronchial secretions. Ensure that the patient is left comfortable as possible. Bronchospasms is further reduced if the patient is relaxed and reassured. Wash and dry the nebulizer cup, tubing, and mask used with warm soapy water. Soak for 20 to 30 minutes. This decreases the chance of pathogen to enter the respiratory tract. Retain the equipment in the polythene bag. This is good for next usage and prevent infection. Document necessary things appropriately, such as nursing practice, adverse effects, abnormal findings that should be reported immediately. After administration of medication, evaluation is necessary. If there is an increased expectoration, less labored breathing, lung sounds improve, and ventilation improve. Again, this is Mira Rose Garcia, a second-year nursing student from Section Wadimbak. Thank you and God bless us all.